This content is AI generated for informational purposes only and should not be directly used for clinical decision-making.
Hello, and welcome back to the Neurosurgery Hub podcast. I'm Dr. Aris, Senior Attending Neurosurgeon.
And I'm Dr. Alara, Research Fellow. Today we're looking at a fascinating new study from the Journal of Neurosurgical Sciences, published in 2026. It's a meta-analysis and systematic review titled The Impact of Membranectomy on Chronic Subdural Hematoma Outcomes.
This is a timely choice, Alara. Chronic subdural hematoma, or CSDH, is easily one of the most common neurosurgical conditions we encounter in our daily practice. Yet, despite how often we treat it, there is still a surprising amount of debate regarding the gold standard of surgical technique.
Exactly. The core of this study addresses that very debate. Specifically, it looks at the role of membranectomy, the surgical excision of the hematoma membranes, in reducing recurrence. As the authors point out right in the abstract, while the condition is common, the actual role of membranectomy in improving outcomes remains highly controversial.
It really is the Achilles heel of CSDH treatment, isn't it? We can perform a perfect evacuation, but the recurrence rates remain frustratingly high in some series. For the residents listening, when we talk about non-membranectomy techniques, we're usually referring to standard burr hole irrigation and drainage without the wider exposure needed to excise the inner or outer membranes.
Right. And that's the tension this meta-analysis seeks to resolve. The researchers evaluated whether the more invasive approach of membranectomy actually improves outcomes compared to those non-membranectomy techniques. When you're looking at a meta-analysis of this scale, what are you looking for specifically in terms of the evidence?
Well, for me, the primary endpoint is always recurrence. If I'm going to convert a straightforward burr hole procedure into a larger craniotomy to perform a membranectomy, I want to know that the benefit to the patient, specifically a lower chance of returning to the OR, outweighs the increased operative time and potential for morbidity.
And that's exactly what the study dives into. The abstract highlights that this systematic review was designed to evaluate whether this specific maneuver improves outcomes. In the neurosurgical literature, outcomes is a broad term, but here they are looking closely at that recurrence rate and how it balances against the procedural risks.
It's interesting that the study mentions the controversy up front. Historically, some surgeons argued that the inner membrane prevents the brain from re-expanding, which creates a persistent space for fluid to reaccumulate. Therefore, removing it should, theoretically, lead to better brain expansion and lower recurrence. But others argue that the surgical trauma of removing that membrane, which can be quite adherent to the arachnoid, might cause more harm than good.
That's a great point, Dr. Aris. The paper focuses on comparing these two schools of thought. By using a meta-analysis approach, the authors are able to aggregate data from multiple studies to see if there is a statistically significant trend that we might miss in smaller single-center trials. They really wanted to see if the impact of membranectomy is a measurable improvement or just an added surgical step with no clinical payoff.
For our residents and fellows, remember that in a systematic review like this, the quality of the conclusion depends on the quality of the studies included. If the meta-analysis is looking at non-membranectomy techniques, it's likely capturing a wide range of standard of care practices, like twist drill craniostomy or traditional burr holes.
And that variety is why the controversial label persists. The paper emphasizes that despite the commonality of CSDH, the surgical community hasn't reached a consensus. By evaluating these outcomes systematically, the study provides a clearer picture of whether we should be more aggressive with the membranes or stick to simpler drainage.
If the data suggests that membranectomy doesn't significantly lower recurrence, it would be hard to justify the extra time and a larger incision. On the other hand, if the impact they found is a significant reduction in reoperation, it might change how we train our residents to approach these cases.
Precisely. The goal of this 2026 review was to provide that evidence-based clarity. It really challenges us to look at our own outcomes and ask if we are doing what is best based on the latest data, or just what we were taught in residency.
Well, it's a vital piece of research for anyone who steps into a neurosurgical OR. CSDH isn't going away, and we owe it to our patients to refine these techniques.
Definitely. It's a fascinating read for anyone interested in the technical nuances of subdural management.
That's all the time we have for today. Thank you for joining us on the Neurosurgery Hub podcast. I'm Dr. Aris.
And I'm Dr. Alara. We'll see you in the next episode.